Welcome to the IHH weekly live stream. Here at IHH for Veteran, we specialize in assisting veterans with their physical and mental health transformation. This group addresses the unique challenges of veterans to improve their overall quality of life. The live stream this evening, we will be discussing patients with ADHD who have benefited from medical cannabis. This is an article by Emily Ellenbong, January 21st, 2024. A recent observational study conducted by the team of UK-based researchers found that medical cannabis may be beneficial for people with ADHD. In the rare study, researchers tracked Pacific cannabis patients with ADHD for 12 months and observed improvements in their anxiety, sleep quality, and health-related quality of life. The patients tolerated the cannabis well. Less than 1/5 of them reported negative side effects, most of which were moderate. The authors argue that these results, while not definitive, nevertheless provide strong motivation for future studies on cannabis and ADHD. Viewed from this perspective, ADHD presents unique benefits such as creative thinking, high energy levels, and hyperfocus. Yet the diagnosis comes with a share of difficulties too, not just difficulty focusing, hyperactivity, and impulsiveness, but higher incidences of sleep issues, anxiety, and depression. These difficulties can negatively impact quality of life, school, work, and social relation. ADHD and cannabis, a 12-month study. To examine the long-term outcome of cannabis use for people with ADHD, researchers in the recent study analyzed data on 68 patients with ADHD from the UK Medical Cannabis Registry. 80% of the patients were already cannabis consumers. Looking at patient-reported outcome measures, as well as patients' daily CBD and THC doses at 1, 3, 6, and 12 month benchmarks, they determined that patients' level of anxiety, sleep quality, and health-related quality of life improved. The cohort also had more male participants, 80.88%, and this may overrepresent how cannabis impacts males with ADHD. Future studies should look at how cannabis might impact male and female patients with ADHD differently. Finally, considering that the majority of the cohort was already using cannabis at the start of the study period, and that a cannabis consumer can develop a tolerance to its effects over time, it is possible that some patients had already developed a tolerance or were receiving maximum benefits from cannabis during their baseline assessment. This could skew the results to show less benefits from cannabis. Overall, the study shows strong evidence that cannabis could benefit those with ADHD, especially when it comes to alleviating the anxiety and sleep disruption associated with the condition. But more research is needed to confirm these results and determine the best ways to use cannabis for these effects. If you're curious about using cannabis for your own ADHD, always consult with a cannabis specializing doctor. To schedule a complimentary assessment, go to my website, veteransvictory.org. Thank you and good evening.